as internationals, as people who are not in Gaza, as organizations that are not delivering services on the ground, we must use the power that we have to influence the decision makers.
GHI is a platform that brings all the entities, all the ecosystem together. It's an aggregator of organizations that wants to deliver healthcare, that are delivering healthcare, that are looking at reviving the healthcare system.
Whatever you have seen in the last 10 months, what we are predicting is worse than what we have seen before.
It is extremely difficult and complex to bring emergency supplies into Gaza.
The situation is very dire, so we need to get moving, we need to get organized, and we need to be coordinated so that we can meet the needs. We need everyone, because the whole issue in Gaza is no longer about Gaza or no longer about Palestine. It actually transcends beyond that. We bring a lot of players, a lot of civil society groups who are doing fantastic things on the ground, but we're trying to align together for everybody to know who's doing what, who should be doing what. I think this is the first time in history, or at least in my experience as a development and humanitarian practitioner, where there hasn't been competition in terms of doing programming and looking at development or humanitarian work.
So we know that the needs of the people in Gaza are very, very high, and there is in no way that we can really meet those needs at the moment because of the lack of access that we have as a humanitarian community with the materials that we want to bring in.
The forecasting is very difficult nowadays, based on the events, the number of casualties, the diseases that are spreading around. So the needs are not that like before.
We need to flood the markets with humanitarian aid. Access should be given, and safety to deliver those goods should be a given.
Without the helping of international community, we cannot continue our support for the patient. Most of our patients in oncology die because of shortage of the treatment and another medical support.
Make sure, for the sake of sustainability, that you work through the grassroots, community-based Palestinian organizations.
People of Gaza are the cornerstone of any successful work that will be done in Gaza. We need to trust those people, to work with them on the ground. Those people has knowledge, has passion, skilled.
They also know very well what is happening in the communities that they work with and that they are part of. So they can very much identify also the specific needs that people have. For example, looking at people with disabilities, looking at cancer survivors, survivors of gender-based violence.
We see huge potential to continue this network of organizations that we've gathered and to continue to mobilize for the Gaza healthcare sector.
There are things that we can do, and we can use these technical insights to leverage and to inspire those that are in decision-making powers to adhere to and allow anyone their basic human rights, including the people of Gaza.
We know what needs to be done. We need the foundational framework of serious global solidarity to implement what we know quickly and urgently.
There is nothing to fear by showing solidarity with humanity. These are people who need support, and it's our responsibility as human beings to do what we can.